A new warning from U.S. senators claims dozens of rural hospitals could be at risk if federal health care cuts move forward, including 14 right here in Washington state.
All new at 5 tonight, our very own Dan Hansen says state health leaders and hospital officials say not so fast.
A warning from Capitol Hill. Now rippling across rural Washington, a new letter from U.S. Senate Democrats claims federal health care cuts could gut Medicaid and ACA funding, putting hundreds of rural hospitals at risk, including 14 in Washington state.
We cannot reduce services to people who actually need health care. I think one of the things that, as part of the understanding of the work around the Medicaid cuts in particular, is about 1 in 4 people in the state of Washington are on Medicaid.
The letter named hospitals like Astria Hospitals in Toppenish and Sunnyside and Prosser Memorial Health, facilities serving largely Medicaid populations and often reporting years of financial strain. But not all of them are on the brink.
I think people are trying to figure out what does it mean. I think, in part of the chaos of this bill passing, this reconciliation bill passing, is people are trying to assess what does it mean for us? Is there something we can change and do?
Astria Health was one of the hospitals included in the Senate list, but leadership says the report paints an incomplete picture. Astria Health sent us this statement. Our hospitals are open, and if you need emergency care, you will always be seen, regardless of your ability to pay, citizenship, or insurance status. We continue to work with lawmakers, pursue new funding opportunities, and make difficult decisions to ensure sustainability and keep care local. I reached out to Prosser Memorial Health for a comment, and am waiting to hear back. Worsham says he feels like there is some good news out of Washington, D.C.
They're looking at grant programs that are, in particular, are really around how to supplement rural health particularly. It is not what we're seeing. It's about $50 billion that will come in for the entire country.
Worsham says he doesn't know what this will mean for Washington. Still, health officials warn that even stable hospitals could face painful choices if deep federal cuts take hold, like trimming maternity care, mental health programs, or emergency services.
We're having those conversations now. We have a little bit of time, and we're going to have to do some advocacy to really help change that landscape of where we're at.
For now, the debate continues in D.C., but rural health systems across the state are watching closely. Dan Hansen, Apple Valley News Now.
While the federal debate over health care funding continues, local hospitals and state health officials say the focus now is on preventing disruptions and making sure rural communities don't lose critical services. It's a story we'll keep following.